Hello, my name is Dr. Lexie Wang and I'm a facial plastic surgeon at West End Plastic Surgery in Washington, D.C. Today's episode of Face the Facts is all about keloids. Now, keloids are unfortunately confused a lot with what are also called hypertrophic scars. The difference between the two is that a hypertrophic scar is a scar that is still within, it's following the lines, it's still within the lines of the cut, but it might be very heaped up, it might be very thick, it might be a little firm. Compare that to a keloid. A keloid means that the scar has now grown beyond where your initial incision or trauma or laceration was. So, you know, if you have a little bit line here, now the keloid is like mushrooming beyond it. And that's what distinguishes a keloid from a hypertrophic scar. We have another video about scar management, which lumps in the hypertrophic scar. So we're gonna focus specifically on keloid management here. First of all, keloids usually are something that you are genetically predisposed to. So now the question becomes, how do we manage it? So when you first have a keloid, if it hasn't grown too big yet, some of the things you can still do are similar to what we talked about in our other scar video, which would be doing things like massage, silicone, as well as injecting with steroids or 5-FU. However, usually keloids are a lot more aggressive and more abundant in terms of scar tissue compared to a typical hypertrophic scar. And so sometimes those techniques are not enough. So then you kind of discuss, well, what comes next? Radiation therapy, which is actually what's used in cancer treatment, is also a very good treatment for keloids. And so that is something else that you might need to consider. As well as sometimes you just have to say, oh, we tried our best, and you just have to excise the area in the keloid and essentially try to re-stitch and re-put things together in a hopefully more appealing fashion for your body so it does not try to recreate a keloid, with the management of a dermatologist or a plastic surgeon who's going to watch that scar as it heals and inject it with medications and things, so that way we prevent the keloid from forming again in the first place. So that's keloids and keloid management. Again, just remember these are different from other big scars, so don't assume that just because you have a big scar that it's due to a keloid. And generally, if you do have a history of getting keloids, you will continue to get keloids, so it is important for you to tell your surgeon that that is something that you are at risk for. And those are my thoughts on that. My name is Dr. Lexie Wang. I'm a facial plastic surgeon in Washington, D.C. at West End Plastic Surgery. We'll see you guys next time on Face the Facts.